Well, welcome everybody to the MGMI Patient Education Conference. We do this every year. For the last 3 years, we have been virtual. We hope to go both virtual and streaming we plan on going in person and streaming next year. It certainly has been an interesting period of time during the pandemic, but I think we're finally coming out of it. I've got my fingers crossed. But I also want to make sure that we can do that safely. So we are doing streaming, especially for the people who can't make it to the area. We couldn't do these type of events without our sponsors. And I just want to do a shout out to two of our sponsors that are platinum sponsors, Alexion and Argenix. They have been supporters of us for the last 3 years. We really appreciate it. They provide funding for a lot of our education things that we do, and it's really been exceptional. We also have other sponsors this year that we didn't even have in previous years. We have two contributing partners, Solio Health, which is a specialty infusion company, and UCB, which has a new medication that is out, and those both are contributing partners. And then our sponsorship partner is Trinity Health, who is a health system in the Grand Rapids area. I want to welcome everybody, and first of all, greet and identify our speakers tonight. This last year was the first time that we did this kind of patients inspiring other patients Thursday night program. And what I really liked about it is that as we got comments afterwards, but we had other people that said, that was just what I needed to really make the change or impetus to really say, I wasn't going to accept, second best for care. I was going to advocate for myself more, or, I was doing pretty well compared to, the two speakers. So this is, again, one of those topics. It is patients inspiring one another. And this is really about MD diagnosis and new therapies and really their experience going through these therapies. Our program this year is all about focusing on current treatments, newer treatments, and antibody status. And this is going to be becoming more and more important as therapies become targeted towards certain antibody status. But what I'd love to do, I'm going to introduce our speakers, and then we're going to kind of go around. First, I have Alice starting, and then I have Dave, and then I have Gloria, and then we'll rotate as we go, pretty much like it was laid out in the speaking discussion guide. First, Dave Peterson is from the west side of the state. He is somebody who has been diagnosed for a number of years and has had treatment changes even in the last year that he has kind of gone through. He had treatments yesterday, right, Dave?
Yes, I did.
Yes.
I had time
Okay.
for apheresis yesterday.
Okay. So, a lot of people are kind of just in that same phase. Alice was just saying that she had treatment today. And so, you're kind of hearing people who are really, right where many of you are. So Dave Peterson is from the west side of the state. Gloria, and I'm going to not murder your name, I just murdered it. Dilsky. Say it again for me. Dilsky, right.
Zilski, put the Z in, please.
Okay, not the D. Zilsky.
Both.
Okay.
A D and a Z is good.
Dzilski.
Well, it's good.
Gloria Dzilski. Thank you very much for correcting me. She is from Wayne County, and I'm not going to tell exactly where you live because I like to make sure that they have that privacy, but from the Wayne County area. So we kind of move further east, and she is somebody who is seronegative, and we have a lot of seronegative content at our conference this year, and so we're really excited to hear kind of her experience. And then Alice White-Comiskey, who is East Sider. So she is from Macomb County area, and we are really ecstatic to have all three of them really being able to be here and kind of answer some questions. If you have questions, if you could please put it in the chat. The chat is that bubble at the bottom that looks like a cartoon character is saying something. And if you click on that chat and choose everyone, you can no matter when you have a question, you can type the question and somebody will filter those to us towards the end of the meeting. And we want to make sure that we have time for that at the end. So please enter your questions if you have some. All right, so we're going to kick it off. So, one of the things is this, I'd like you to tell us something about each of you individually outside of MG. So we're here to talk about MG, but MG is not our life. It's not everything that we do. It is things that you're getting treatment for. But give me an overview of kind of what you're doing and kind of who is amongst your life and kind of what you love to do, or what you would like to tell me, or what you feel comfortable telling me. Alice, could you go first?
Sure. I want to mention that today my voice is a little hyper nasal, so I do apologize if I sound a little bit like a cartoon character or someone on helium. But I'm going to do my best to try and talk in a deep voice. My name is Alice, and everybody has always gotten my name wrong, so I always make sure that I tell them I am like in Wonderland, and I live in my own little Wonderland. Especially since myasthenia gravis, I've learned that it's very important to stay positive. It's not hard for me because I've always been in retail, and in retail you always have to be bubbly and friendly and in charge and organized, and that was me. That was always me. I was always very social butterfly, always out with my friends and throwing parties. Once my husband and I had our own home, we had an annual Halloween party that would get bigger and bigger every year. And at one point, I think I had 75 people in my house. And that was a great year. We would have a live band, and that year we actually had a comedian. So everybody, we had wonderful costumes all the time, and we had a really full life, and my myasthenia presented in a big fist to the gut when I was in my 40s, and I was very obese at the time. I weighed about 300 pounds. And my doctors all told me that my problem was because I was fat. Oh, if you lost 100 pounds, you would feel so much better.
Hey, Alice, I want you to go into that next during the time of where we have that section of the questions.
It's hard to get back there. It's been so long, it's been 12 years since my diagnosis. So I'm just now learning how to have a real life again since the Vineyard has given that back to me, but we'll get into that too. But I have a dog and I have a husband that I've been married to for 29 years. We just celebrated our 29th anniversary. He's a big sweetie. He takes real good care of me. But he can be a real pickle at times because, he's a man and he's my husband, and it's never 100%. But anyway, he's a really good caregiver, and I'm very blessed to have him in my life. We share our home with my mom, who is 81 years young, and we have a little dog, and her name is Lala. And I'm an auntie. I have no children, So I'm an auntie to many wonderful grown adults now, and I have grand nieces and nephews. So I won't be a grandma, but I'm a grand auntie. So I take that very personal. And
Great.
that's about all there is about me.
Thank you very much. Dave, you want to take it?
Thank you, Susan. My name is Dave Peterson, and I live over on the west side of the state, on a community on the shores of beautiful Lake Michigan with my wife, Donna. We've been married 63 years this year, and we have 3 children and 6 grandchildren and 6 great-grandchildren. And by the way, I'm very jealous of you folks that have your good kids, grandkids, and great-grandkids close by. Ours are all in Alabama and in Washington, D.C. So we don't see them as often as a lot of you might. I'm retired from Michigan State University since 2022 when I was diagnosed, and I had to retire at that point in time. So I've been on my journey since then.
Dave, what did you do for Michigan State University?
I was at Michigan State University Extension, and which is an outreach program of the university, and that's where I've been located in Mason County during my tenure of working for MSU.
Fantastic. Thank you so much. Gloria, you want to take that?
Hi, yes. Hello, everybody. I've written my comments so that I can stay on point, not digress. My husband, Walter, and I have been married for 46 years. We raised 3 boys, but 2 have passed. We are close to our son, Matt, our daughter-in-law, Jamie, and 2 adult grandchildren, Joelle and Joseph. We also have many great nieces and nephews. And when I met my husband, I was divorced with 2 young sons. I was successful at working in outside sales and earned almost as much money as he did, even though he was an executive with Ford Motor Company. I gave up trying to work a long time ago. Sales work was exhausting work. I loved it when I was healthy, but developing autoimmune diseases with chronic fatigue changes you. I even tried to change careers at one point, but I could not see myself ever being able to put in an 8-hour day. And in addition to that, I stopped driving about 4 years ago. About 25 years ago, Walt began working from home in order to be a caregiver to me. 6 years ago, he started his own business, so it was easier to schedule medical appointments. He says he now has the best boss he ever had in his life. Of course, he means himself, gives himself permission to do whatever he wants to do. And Walter and I live in a lovely small condo community in Livonia called the Villas. Our son, Matt, recently moved back home to help us navigate our next great adventure. And this is Walter's kidney cancer diagnosis. Walter had surgery 2 weeks ago to remove a tumor from his left kidney. We are told that recovery will be long and difficult, probably months. So now I am caregiver to Walter. Our son, Matt, is picking up the slack with Walt's customers. He's available to drive Walt. He and Walt went to Cleveland Clinic together for Walt's surgery. I stayed home with my daughter-in-law. And we have also recently hired a cook/elder caregiver for me and Walt. Walt is home now and on the mend. The pathology report said they got all the tumor, and that is very good news.
Fantastic. Thank you so much. I'm really glad that Walt is home, and I saw him just briefly as he was helping you out with your computer. So I'm really glad he is listening tonight as well. So let's go into your MG journey. So, if you could give us an idea of when it started, if you know your antibody status. I've already kind of shared some of that, but if you know your antibody status or when you found out about that, give us some idea on that, and give us an idea kind of your scope of treatment up until the therapy that you're on now, because that's the next question. Dave, you want to go first?
My journey began approximately a year and a half to 2 years before I was diagnosed. I was having trouble with fatigue, the typical symptoms that a lot of you know about, and that was the main thing. I found that I was very, very inefficient. I wasn't getting my job done properly. I didn't know why, and I became very frustrated. I became short-tempered. I didn't know why all this was happening. If someone would come into my office, I always had to sit down. I could never stand up very long. And I just didn't know what was going on. A matter of fact, my wife, Donna, did not allow me to use the O word at that point in time. She does now, by the way. But anyway, I was not diagnosed until I began to get ocular issues, as well as swallowing and talking. And so that's when I saw my ophthalmologist. It happened to be on a Sunday morning, and I got immediate, took me over to the ER and went through the ritual and found out I did not have a brain tumor. And so that's when the chase began. And I've had 4 neurologists. The first one I had about a week, and because he started out okay, and he had me diagnosed, and they started second guessing himself. And 1 week later, my wife had enough of that. We happened to have a contact at Mayo Clinic, so we went over there immediately, and I was diagnosed the same day. Pending tests, and yes, test confirmed it. So that's when I started, and it's been quite a ride since then. I got a second neurologist who put me on Mestinon, which did not work at all. All that Mestinon made me do was drool. I think I drooled gallons. I need to put a towel on my chest. And that was tough. And I guess I'd have made a good Italian at a spaghetti dinner or something. But anyway, my next neurologist, that wasn't a good fit. My next neurologist was an excellent fit. And so he started me on I think I've been on all the drugs so far, because they all quit sooner or later. Imuran was a real problem in that I had extreme high temperatures, as high as 104, and spent some time in the hospital at University of Alabama. And then the next drug was Cellcept, and that was another tough one. Temperature, same thing, so that was just a very, very difficult time. When I was on Cellcept, that's when I started my plasmapheresis treatments, which I've had intermittently all through the years. And then we found that IVIG worked pretty good, and I was on that over 10 years. And until all of a sudden that just quit working, just overnight, no more effect. And the same with Rituxan. That didn't work very long at all. So it's been quite a ride going through all of these. Then that particular neurologist left private practice and went to a hospital. So that's when I have got my current neurologist, a neuromuscular specialist, who has been just absolutely excellent with me. So that takes me all the way up to spring of 2022. Susan, I don't know if you want me to continue or if I've gone too long here. I've had some, that's when basically when my real issues started with difficulty. In the spring of 22, I had an exacerbation, which was caused by the RSV virus, and which both my wife and I had very, very bad. And so then I went through plasmapheresis again with home care and oxygen for several months. And then I went on a home ventilator nights, which I'm still on at this time. So that's been kind of a tough one. And then I went on Vyvgart early on. I was a very one of the early patients, I'm told, on Vyvgart, and that worked. I've had it. Let me see. I was on that in early 23, and until last June, when I had another exacerbation, and I at that point in time, I spent, what was it, 24 days in the hospital. And of course, that was the end of Vyvgart. And so currently, I'm on plasmapheresis weekly, and along with 25 milligrams of prednisone per day. And I expect when I have my next appointment on the 25th, that prednisone is going to have to be changed. But I've been wrong before. So I'm getting along fairly well now. Not great. I can't do too much. Helping to make the bed and to load the dishwasher is about all I can do. And then I have to, I'm, as I call it, down for a while in my chair. I have had some issues with breathing, primarily when I've had exacerbations. So that's pretty much a recap of my journey down through time.
Thanks for that time capsule. You mentioned that you were on a vent, an in-home vent. Was that a trilogy or was it a BiPAP that you're on?
I'm on the what is it, well, I forgot the model, but it is a ventilator, a home ventilator.
Okay.
Yeah.
Yeah, BiPAP.
Yeah. Because it breathes for me when I can't.
Both in and out, correct?
In and out. Yes.
Okay, great. I just wanted to make sure that everyone knew that, that was a BiPAP. And, unfortunately, your experience with viruses, and that's why COVID was so tough. Viruses can change both what antibodies your body produces. It can actually produce other antibodies. It can hijack antibodies. And this is the neuroimmunology is one of the things that is kind of a newer science. And, and now they have RSV vaccine. And I don't know whether that your physician has suggested you get that, but
yes, we've had all of them that are recommended. Yes.
Okay. Because one of the things is you can be vaccinated, but sometimes people with MG or other neuroimmunological issues don't build antibodies against those. So even the immunizations can sometimes not be as successful. That's true in MS. We've seen that. So thanks very much, Dave, for giving us that. You had quite a 10-year stint when you were doing well, and then just that the viruses seem to really cause upheaval.
That's exactly right. Yes.
Gloria, you want to jump in and give us your story?
Sure. Okay, I was diagnosed in 2001 by single fiber EMG by Dr. James Albers from the University of Michigan. Although I had antibodies already to thyroid and skeletal muscle and anti-centromere antibodies seen in scleroderma, I did not have the acetylcholine receptor antibodies. So my diagnosis became seronegative GMG, class 2B, or a moderate neuromuscular disease. My neurologist was Dr. David Simpson from the Mind Clinic. He ordered IVIG once a month with infusions at home. That went well from 2002 through 2010. I never had a remission, but I never had an MG crisis either. I was able at that time to volunteer at a local hospice. Dr. Simpson acted much more like an internist. He was a very good doctor for me. Since I'd been diagnosed with autoimmune thyroid and adrenal disease, he was a good person to talk to about everything that was happening health-wise. Dr. Simpson retired in 2010. And also at that time, I had been developing problems with my kidneys. Some abnormalities were showing up consistently with kidney testing, and I was a little concerned about the IVIG, and I wanted to take a break, so I did. Then my doctor retired, but in the meantime, he referred me to Dr. Tiener at the University of Michigan. And there was a delay of about 2 years before I could be seen. So I went without a doctor or treatment during that period of time. And then there was another delay for treatment of 10 years because Dr. Tiener and I didn't agree on treatment. He was a big fan of plasmapheresis. I, however, was too afraid to try it and never did. So I was untreated during that period of time. In 2010, I was diagnosed with celiac disease. That's another autoimmune disease that actually means you're allergic to gluten or wheat. And I spent many years consulting with dietitians and other healthcare providers about how to eat healthy and enjoy meals and snacks that were gluten-free. And to reduce inflammation, I went all the way. I went dairy-free and sugar-free. And I'm up to question 3. So this is just before.
And
Go ahead,
Dr.
Susan.
Dave, did you see Dr. Simpson also?
No, I did
Okay.
not.
So Dr. Simpson used to be at MSU also. He was over there for quite a while before he went to the Mind Clinic. And you see a doctor, a special kind of doctor that you saw for a lot of the autoimmune things. What type of doctor is that, Gloria, that you see?
Are you referring to the functional medicine?
Yeah.
Now that's only recently, like this year, 2023. I started with that just to see where that would go. And that looks very promising. Just some small things that she's recommending. I had been, for some reason, I lost a lot of weight. We really don't know why. Most women think that, oh, that you're lucky, you eat, you lose weight. But at some point, because I'm a cancer survivor, a breast cancer survivor, doctors get very nervous when you have unexplained weight, when you become underweight for no good reason, because they think it's a cancer recurrence. They always want to do a lot of tests and scanning, and that's more radiation. And if you've had cancer, you're afraid of radiation. You don't want to do it unless absolutely necessary. Well, with the functional medicine doctor, she noticed my thyroid tests were normal, my TSH, T3, and T4, but she thought my TSH should be higher, even though it was in the normal range. So she adjusted my thyroid a little bit. And the first thing I noticed, I gained a few pounds, and that's promising. So this weight loss stopped, made me happy, made the doctors happy. My fingernails that were splitting and breaking suddenly are smoother and healthier and not breaking. And I can't believe that it's just a small adjustment in the thyroid could do that. And that wasn't being picked up on by my primary care, because in their world, all the numbers were normal. I'm still normal. Just she wanted a higher TSH. She thought it was healthier. And I'm on that journey to see where functional medicine can take me.
Thanks for giving us that background. I think that, as you get additional autoimmune diseases, that primary care physicians really don't know things about or don't have experience with a lot of them. I think that it's, great to be able to seek somebody who really has an idea how all of that works together. So I'll look forward to having you share that experience and as it goes along. Now, Alice, now you can jump into that.
Actually, it's my segue is my diagnosis was really difficult for me because I was actually treated by two different neurologists that had no idea that I had myasthenia gravis. And I was getting very, very ill at a pretty rapid rate. This was back in 2011. And my girlfriend lived in California and she had a functional medicine doctor that she saw, and she swore by her that she helped her nip some MS worries in the bud for her early on by changes in her diet and lifestyle and things like that. So I started consulting with this lady. Her name is Dr. Alexis Daniels, and she is the one that helped me figure out that I had myasthenia gravis. I was actually hospitalized for myasthenia gravis in August of 2011. Finally, I had told my doctor in Port Huron, Michigan, that I needed to go to the city and see a big city doctor. And so he made some phone calls and found Dr. Richard Lewis in downtown at Harper Hospital at the DMC. And he checked me in through the ER, and they determined that I indeed had myasthenia. I had every symptom on the spectrum at a 10. I was almost in crisis, and they put a catheter in my neck and started plasmapheresis the next day. I was already on methadone because we did not know I had MuSK at that time. And while in the hospital, I was getting so bad that we were actually giving me methadone intravenously, thinking that I needed it at a steady schedule. And what was actually happening is it was putting me into colorectal crisis. And I was almost on a vent. I had to use suction to get my saliva out of my throat because I could not swallow. And my functional medicine doctor got my MuSK test back. And she emailed me while I was in the hospital. And she said, Alice, you have the MuSK antibody. She said, boy, oh boy, you have the MuSK antibody. And I think it's like a positive 20 is a positive for MuSK. And I had 2020, my teeter level. I was over the top. And
That's called overachiever. Overachiever in MuSK.
And so immediately Dr. Lewis was like, oh my gosh, this explains everything. And he took me off the medicine. And within 3 plasma exchanges, I was 85% normal. Like I could speak, I could swallow, everything, but it was very short-lived. As we know, plasma exchange is a constant. thing that you have to do as you create these antibodies. And because I had a very high risk of cancer, I lost my dad to kidney cancer in 2011 after a very, very long battle. So no one should ever believe that something is dire when you have faith and you have determination, because that man, he did it good. So anyway, and then I lost my brother to cancer, and I lost my aunt and my grandmother, and so many people in my family. And so immunosuppressants were not something that I was able to even consider in my mind. And I weighed 300 pounds. So putting prednisone in my body sounded like a totally ridiculous thing to me, because I couldn't breathe as it was, and they wanted me to get bigger. And I said, I can't do it, and so finally, Dr. Lewis, he listened to my reasoning and he said, well, do plasmapheresis as your treatment. And it was approved by my insurance, and I did plasmapheresis to control my myasthenia gravis for 5 years. And then it wasn't really wanting to work so good anymore. I was having to go more often. And a friend of mine introduced me to an alternative therapy called the Ion Cleanse by A Major Difference. And it's an ionic foot bath. And she had been using it for her daughter with autism to try and help her detox, things that might be attacking her system and creating her issues. And she was having good success with having some things happen. So I also started to do the foot bath on a regular schedule. We actually did a survey, a study about the effectiveness of it for myasthenia gravis patients. And during my first 3 months, I had a 38% reduction in my symptom levels. And I also was able to reduce my amount of pheresis that I needed. By the time I got to 6 months, we were done doing pheresis altogether. And my neurologist said that I was in remission. And for almost 9 months, while using the Ion Cleanse foot bath, 3 to 4 days a week, depending on my schedule, I was not needing pheresis. I was in a complete and total remission. But then I got breast cancer. And I caught it early on my regular mammogram. But as you know, breast cancer brings a lot of things into your life, like chemotherapy and radiation and surgery and stress and fear. And none of those things are good for myasthenia. And so there I went, right back down into the hole. And so here I was back on pheresis. Luckily, I am very personable from what I'm told. And so I kept going to the same hospital, and everyone was glad to see me. And I was glad to see them because they were my friends too, my caregivers and my friends. And so my journey with my myasthenia has been up and down and all around. But my veins have not wanted to work for pheresis anymore. And so when I was offered the chance to try Vyvgart, I had seen how it had some really good results, not very many side effects, and I figured it was worth a try. And I started it in June, was my first round. And the day after I started, I noticed a visible reduction in my symptoms right away. It was remarkable. And pheresis didn't even do that to me. Like just make it go whoop. Because I could not swallow when I got my infusion. And then I woke up the day later and I ate a full breakfast. And I said, oh my gosh, this is wonderful, you know. So with the Vyvgart, I am doing real well. I'm on my third round now. And this round, we started the Hytrulo, which is the subcutaneous Vyvgart. And I have noticed that it doesn't work as fast as the intravenous on my Mosk MG, but it does eventually get it down where it needs to go. Because today was my third round and my MG ADL score is a 3. And that is so wonderful. My nasal speech is one of the main reasons I'm not lower. So, but.
So you mentioned as we were going through your early story that that you were 300 pounds and, you know, prednisone was one of the things that you didn't want to do. One of the things that I found so compelling when I was talking to you earlier was that you really reached a point, and Brian, your husband, even was, you know, got tears in his eyes when he was talking about this, that you really were not able to eat and were really limited in mobility because you weren't able to eat to have strength, and you lost how much weight?
I lost 110 pounds. Yeah. And overall, I lost 120 altogether. So I used to be 300, and now I'm about 180. So I'm about a normal size gal now.
Well, congratulations on the weight loss, but that is not a diet that I recommend anybody duplicating and getting MG and then going that route, because it really sounds terrifying. And I remember Brian being, you know, just really emotional in that you had a good result and you like to eat a specific hamburger and that you had not been able to eat anything for so long. And it was really after your first 2 or 3 treatments that you were able to, you know, eat what you wanted to eat. And that was something
My
that you had
dad
not
and I
seen.
used to always like to get a big double cheeseburger. And we've had them all over the country, you know, double cheeseburger, all kinds of, you know, lettuce and tomato. And when you have myasthenia gravis, your mouth doesn't want to open all the way. You can't get that big old cheeseburger in there. And
Not
then
only that, but the chewing, you know, chewing and
not to
swallowing.
mention the chewing and the swallowing. Yeah. So
Well, thanks for sharing that. All of you had, you know, a period of time when things were going well, but you've also had these ups and downs, like a lot of people with MG, and finding, and Dave, I would say of the two of them, you're somebody who is at a point where you're going to be addressing it with your doctor for another change, because Plex is, you know, something really more along the, every week treatment. So it's not a continuous treatment, but it certainly is a treatment that's meant to stabilize. As we go into this next phase, because I think that is one of the things of looking for the next treatment, and Gloria, you're going to start this one off, is the treatment that you're on now. If you could let us know that.
Okay.
And also your path to that, but then also where are you now in terms of, as you know, the ups and downs of MG in considering other options, and how have you been looking for that? So go ahead, take it away.
Okay. My current therapy is sub-Q IG. I infuse once a week under the skin Hizentra immunoglobulin serum. It takes 1.5 to 2 hours. I need only a little help in inserting the needles and removing and disposing at the end of the treatment. The symptoms that drove me to seeking therapy was the fact that I was sleeping up to 6 hours a day. In addition, that was spread over 3 naps a day, and also sleeping 7 hours at night. I became very short of breath with very little activity. I think Dave mentioned he helps his wife make the bed. That would be nice. I struggle with making our bed or changing our sheets. I certainly was then. I just couldn't do it alone. I had to have help. I noticed that I couldn't sing along with my church congregation. When I was a child, I was in a children's choir, and I can really remember the teacher teaching us how to manage our breath, how to sing along for the whole line and take a breath at the comma or the period. Well, I could no longer do that. I would sing a word and gasp and sing another word and gasp. And this is where I was before I found sub-Q. I also noticed that my eyelids were forever droopy. No matter how much sleep I got, I just could not hold them open. Anytime we wanted to take a picture, I was always spoiling it. It was Nana, got to take another one. Your eyes are closed. Or Aunt Gloria, open your eyes. I was doing my best. Yeah, if I give them the Google eye, then that spoiled the picture too. So
I'm trying.
that's where I was. So I actually, at this time, this was the beginning of COVID, and you know how hard it was to make contact with anybody. I had sort of lost track of my local myasthenia support group, but somehow God intervened. I sent an email which I thought was going to our local support group, and actually it went to MGMI in Grand Rapids, and Esther Land called me back one day, and we had a great conversation, and she listened very well on my issues and problems, and she suggested that I should go see Dr. Joel Phillips over at Trinity Health, a neuropalliative doctor. And in one visit, my full vital capacity, that's the neuromuscular test for breathing, was tested, and my score was abnormal. And Dr. Phillips told me I had lost 2/3 of my muscles due to atrophy. That's from not being treated all those years. And he also said that this was permanent and couldn't be reversed. He also ordered a BiPAP machine that changed my life. At first, I used it whenever I felt excessively short of breath, and also at night. It took me months to find the right mask, the right machine, the right medical supplier, but I finally got to a place where I began using it at night, all night. And I have no more morning headaches. For years, I thought I was addicted to coffee because I woke up every morning with a headache and had to have my coffee. Now I wake up without the headache, but I still like my coffee, so I'm there. And I realized in looking back many years, back into the 90s, when I was in my 40s, I would wake up at night gasping for air, and it felt like I had stopped breathing. And I'd wake up with kind of like gasping, and this would be on and off all night long. And this was every night. And I was living in California. I was seeing doctors at Stanford. And I would ask for a sleep study and they would tell me no. And I'd ask why. And they'd say, because you're too young. And so I was refused a sleep study. I didn't know why I had this problem. And they did not refer me to a neurologist either, even though I had skeletal muscle antibodies and a bunch of other things. It just kind of left me out there hanging in the wind. But anyway, after talking with Esther at MGMI, in subsequent phone calls, she mentioned sub-QIG. And since I had very good results with IVIG in years previous, I decided to try it. And this worked for me. And it really works great for my full-time working husband / caregiver, because we choose the day, we choose the time, we change it, we switch it, we make it to suit us. And that seems to work. And I want to mention to you, Alice, that I've been using the Ion foot bath, both my husband and I, for about 17 years. I guess we're kind of using it for maintenance. We'd use it once a week. And I make a habit of doing it the night before I know I'm going to do my sub-QIG. And
Yeah.
what is the difference is if I don't do the foot bath, that bubble you get with the sub-Q, the big fat tissue that puffs up,
Yeah.
stays with you longer. If I do the Ion foot bath, it must cleanse your system in such a way.
So your lymphatics can absorb it faster.
Exactly. It gets absorbed
That's so
faster.
cool.
Within 24, 48 hours, it seems to be all absorbed and gone. So
We need to connect more. We need to connect more.
we need
Yeah.
to mention that out. I totally forgot about that until you mentioned it.
That's amazing, Gloria.
Back to my sub-QIG.
Back to your story.
Yeah, Dr. Tiener was very helpful in, once I asked him for the sub-QIG, he was very helpful in ordering it. He wrote the prescription and he had a real good infusion company that's helped us out too. They not only send the serum and supplies, this infusion company called New Factor offers, they called it a compassionate care program. And you apply for it on an annual basis, and you had to list your expenses and income. And I thought for sure we'd be denied, but as it turned out, we were accepted. And what they're doing is they're waiving or absorbing our share of the out-of-pocket copay that we would normally have to pay. So they're accepting Medicare Part D copay in full completely, and we're not paying anything else out of pocket. And
Nice.
right now, that's very helpful for us because of my husband trying to go back to work after this kidney cancer. He's determined to work. He's 76 years old. People tell him it's time to retire, but he says his phone won't stop ringing, so he can't retire. And he works for himself. But, you know, we don't know the future, and so we don't know our future income too. And that's always a scary situation. Another doctor that intervened in my care was Dr. Standiford at U of M, and he's a pulmonary doctor. And again, I hate to say things that might be negative about Dr. Tiener since he's passed away and he's not here to defend himself, but what I'm saying is the truth. He told me that my pulmonary function test, the specific full vital capacity was normal, when even the technician who did the test told me it wasn't. But I couldn't get around him really supporting the idea of me being on a BiPAP. So I kind of pushed my primary care into thinking what we could do about that. She referred me to the head of pulmonology at U of M, a doctor by the name of Dr. Standiford. He was wonderful. He told me that my full vital capacity was not normal. He sent me to the vent clinic at U of M. They repeated the test that Dr. Phillips did that showed I was abnormal. Now, of course, U of M believes I am abnormal because they did the testing. And they're supporting the BiPAP and they're doing a good job. They helped me with, suggestions about the mask and how to use it and how to get it adjusted to it. So that's a lot of my story.
Thanks, Gloria. I want to mention that we do have a sleep doctor who's going to talk about BiPAP and CPAP on Sunday as part of this conference. So please join us at noon on Sunday. Same link that you did to get into this one. You're going to hear about some of those things. And I want to make sure that the things that Gloria is talking about now, and of course, Dave talked about, are going to be covered in that sleep talk. All right, Alice, your path to, getting the treatment that you're on now, and, the catalyst, what was the catalyst for that therapy?
I mean, I'm really not sure. I mean, I've been up and down so many times, and basically my only treatment was plasma exchange. I was doing it anywhere from once a week to once every 2 months, 3 months at times. But in 2011, shortly after my diagnosis, I had only been getting plasma exchange for a couple of months when they were having to put it in my neck, the access, and I developed a blood clot in my jugular. And so we weren't able to use that access for plasma exchange anymore. And my interventional radiologist at the DMC, Dr. Monty Harville, they treated a lot of sickle cell patients at the DMC, and they used a femoral line placement for them, where they put the line in the groin instead of in the neck, and then they take it out that same day. And I said, let's try it. It has to be better than the neck. And I was sold. It was the best thing that happened to me since my diagnosis. I was able to go home with nothing sticking out of me. I only had a bandage for 24 hours, and then I was normal. Well, except for myasthenia gravis, because rhesus would only get me, to about 80, 85%. And then if I pushed myself, I would go back down, and so I didn't have a lot of stability with the plasma exchange. I look back on it now and I realize that I was so stubborn. 12 years is a long time to be on a crazy roller coaster, and everybody says, you have myasthenia. You should do the rituximab. People are going into full remission with rituximab. But I would read online and all of my support groups on Facebook, and people on Rituxan still needed Mestinon. They still needed prednisone. They were still on Cellcept or IVIG. It wasn't a miracle drug that could replace everything else. And I was only on one thing, plasma exchange. And so I said, no, I can't, because I would have to be off the plasma exchange for at least 3 weeks, they said. And I said, I'm not going to commit, And that's where the Ion Cleanse really helped me to find stability with the plasma exchange, because with the two of them, and with my functional medicine doctor, she helped me learn how to do the AIP diet, the elimination diet, where you find out if you have any foods that are triggering you, and find your environmental allergens. And I really was very diligent, throughout this last decade about trying to do all of that. But I think the biggest thing that helps me in my journey is to live in joy, just to embrace the joy in your heart, every little speck of happiness in your day. I see that Eric has a beautiful Siamese kitty on his lap, and she just made me giggle because she just came in and interrupted the whole thing. She doesn't even care. And, but, whatever your joy is, hold that dear, because that's something that myasthenia can't take away from you. Is what you have in your heart, and that keeps me up on top of the soil, on the right side of the grass.
Did your diagnosis with cancer have any impact on why you chose to not do Rituxan as well?
I had determined I determined not to do Rituxan in 2012. When it was offered to me by Dr. Lewis, because my dad, in the late stages of his cancer journey, he developed an eruption of the bowel. And one of the very first side effects that they warn you about with rituximab is that you could have obstruction and perforation of the bowel. And me and my dad are very similar. We have the same skin, we have the same feet, we have the same hair. And if we have the same colon, that wasn't going to work out good for me.
Yeah.
And
that's a very serious situation.
And so my doctor was always having a hard time, with that. But I said, hey, I do not want to deal with that on top of this. But we need something better.
Mm-hmm.
And so
Thanks.
they kept looking.
So Dave, your path, was really fixed from what you were on and what stopped working. But your therapy that you're on now, what's the conversation that you'll have with your doctor as you kind of, look towards what's going to happen next?
Right. Well, I suspect, number one, that we'll have to approach the prednisone issue. I feel personally that 25 milligrams per day is a lot of prednisone for an extended period of time. So I kind of expect a taper to start on that. And that's one thing we'll talk about. But then you brought up the other issue, and that is that the plasmapheresis also is, I don't want to use the word stopgap maybe, but it's not necessarily a long-term situation either. So I'm really actually very curious as to what my neurologist is going to say, but I absolutely don't know, because I've had about everything. And I even forgot that I was also on Solaris, which quit working after a period of time. So I've been on just about all of the drugs. I guess that's just kind of the way I feel about my upcoming visit.
Now, did you have a thymectomy, Dave?
I did not. I
Okay.
didn't need it. They checked
Okay.
that in a clinic early on.
Okay.
Yes.
Good.
I was just a tiny little, it was about gone, I guess. Of course, I was older.
Yeah, so I mean, a lot of the things in your discussion, and all three of you discussing kind of the ups and downs, while all of them were different and all of them with different antibody status, the ups and downs were still persistent. And I think that that's, being an advocate for your own MG-ADL, for what you're experiencing, the side effects of, a medication or side effects from treatment. Dave, in your case, traveling and during winter from where you live to the infusion center is not a small thing. And
That's right. It's 100 miles every week to get my flex, and it's going to get tougher as we get into winter. And my neurologist and I have talked about that also. So this is going to enter into the discussion as well. Yes.
how do you advocate for yourself with, how do you have a conversation with your doctor? I think everybody has an idea, of course, what they want to have a conversation about. How does that work for you in advocating for your own care with your doctor?
Well, I have maybe a different attitude than a lot of people. I feel that I have a partnership with my neurologist, and I feel that I would do my homework, and my wife is just excellent at also doing homework. And so we like to be as informed as we can, but we don't overthink things. We don't get off on biases. We try to be as objective as we can and go to places that have some that are well respected, and to learn what we do. But we have to keep in mind that our neurologist knows far, far more than we do about it. And so I will always take my neurologist's advice over my own, even if I might have a doubt, but I won't do that without talking to her about it. Is that helpful?
Yeah, I think that the partnership is a great term that you use, because I think that all of us want that. And it's great that you have been able to establish it. I do know your neurologist, and they are a very easy to talk to person. And so I think that, and they also want to know in this particular neurologist. I don't know that that's always the case. And neurologists come in a lot of different flavors. And so finding somebody,
if they cannot trust their neurologist, they need to move on. There's no crime in that. And I just, well, I've been through that. Let's put it that way.
Yeah, that was part of your earlier discussion. And I love your description of Donna firing your first neurologist, that she pretty much had enough of that. That's what you said.
That's exactly right.
And I think that, family and how you're being treated are all part of that, and whether you have a voice in that, and whether there's a partnership. So I love that you use that phrase. Gloria, how about your partnership? Or how do you advocate for yourself? You told us some of that, but in looking for what's next for you, because sub-Q is something that you got because that was what you needed during the time that you were looking for something you didn't have, and you could get it during COVID, and it was kind of the perfect thing. But the ups and downs, how do you evaluate both what's possible with what's happening with you? How do you go about that?
I'm not sure. I'm I have ups and downs like anyone else, but I kind of want to address Dave a little bit, because I did try to find other neurologists. I just didn't mention it earlier. And some of the drugs they were mentioning are ones that you've experienced and not had good results with. And I've heard this from others. Part of the complication with my medical history, I have 5 or 6 autoimmune diseases. And what Dr. Tiner was explaining to me, why he was advocating for plasmapheresis, but also strongly warning me I would be at very high risk for a very bad outcome, because it was an unknown, especially because of my adrenal collapse. He wasn't sure. He had never treated anyone before with adrenal insufficiency on plasmapheresis. Didn't really know what would happen during an emergency. Did you have that, Alice? Adrenal collapse?
Yeah, when I was first diagnosed.
He emphasized,
Oops, I think
kept thinking there was something else there for me. My instincts have guided me through a lot of this. I didn't have a name. I didn't have any. I'm getting a warning that my internet connection's unstable, so I hope
We still
I can
hear you.
continue.
Yeah, we
Okay.
still hear you.
So anyway, my new doctor is Dr. Gallagher at the University of Michigan. We've not met face to face. We've had a couple Zoom meetings. I've moved up our face to face visit, and so I hope we'll have a good discussion with him face to face. Because I don't know how long I can stay with sub-QIG. I'm having a little bit of trouble with the infusions. Since I'm very thin, I don't have much body fat or tissue to go into. And I'm having trouble with leakage or incomplete infusions. And I kind of at the point where I know that this is not indefinite or permanent, but I don't know how long I can stay. So my next meeting with him will be at the end of this month. I'm going to ask him, given the situation, what his suggestions or recommendations would be, what would be the options for me. But I've had very good results with the sub-QIG. My kidney function is better than it's been in many years. So it's kind of my kidneys. So I'm in favor of anything that will preserve my kidney function. I'm
Yeah,
not so sure about the rest. So I guess to answer your question, I'm saying, I don't know. It's a big fat. I don't know. There's a lot of pros and cons, and looking forward to getting to know Dr. Gallagher better and see what we can do together to figure out what needs to be done. They like to say that I'm doing fine, but to me, it's not fine because we always want to be normal, whatever that was. It's kind of like we remember how we were before myasthenia. And we always know people who are doing better than we are with their myasthenia, or capable of more, or have more stamina or more strength. And of course, we want that. That's the kind we want. But we have the kind that we have. So
Right.
it is what it is. But I have to, I guess I won't go any further because you have more questions that you want to address.
Yeah, we're going to go into a lightning round here where we're just approaching the time when we want to start for questions, and I see a couple in the chat now. Rhonda, if you could look at the chat and kind of prioritize those questions for me before we get to the point where we're asking them. So in this lightning round, which means fast, kind of, a couple sentences. So
I feel outed. I'm trying to be chatty, Kathy.
Before we get to that, I want to mention that, of course, our conference continues on Saturday and Sunday. Saturday starts at 9 o'clock in the morning. Same chat. You're welcome to go to our website to see who's speaking on Saturday. We have some really great presenters. We have somebody coming in from Yale, or actually Zooming in from Yale, who's talking about seronegative. And we have a wellness person who's also has worked in functional medicine, who's a neurologist out of Illinois, who's just really wonderful. So I think that some of our conversation tonight will be recovered or covered again in her talk, which was really wonderful. So in this lightning round, what would you recommend to others based on the path that you've been on? What advice would you give others on advocating for yourself? Alice, you first.
As far as advocating for myself, I found that my doctors listen to me more when I use the words that they use. So you have to do the research. Everybody says, don't Google. Well, you don't want to Google. You want to go to your foundation websites and use their resources and learn as much as you can about what you're going to talk to them about. You go, if you want to talk to them about Rituxan, then go to the Rituxan website. Contact their representatives, ask them questions, because your doctor might not know all the answers that the people at the company will know. I personally, before I started VivGuard, I signed up for VivGuard University, which is a seminar that they put on for patients. And it was in Livonia. And it was actually the day before I started VivGuard. And I met Susan there that night, and it was great. I mean, and they had never known anybody with myasthenia that had done the video yet. So, you know, you never know what is going to be the thing that helps you. And so even though your cousin's neighbor thinks that this diet might help and it's really super annoying, look into it. It only takes you a few minutes, you know? I mean, maybe it'll make your skin look better and you'll smile more, or, you know, so everything is worth a try. And be as informed as you can.
Thanks, Alice. Dave, what are some of the recommendations you have on really advocating for yourself?
First, I would echo what Alice said, in that you didn't. I'll put it in terms of be informed. When you talk to your doctor, they deal in facts, and I feel that the more informed you are, the more you're going to learn back from them. And so that would be number one. And another thing that I think about is be positive. Have a positive discussion, because if somebody comes in complaining all the time, that gets to be a real downer, and you don't have good discussions about it. You know, back to the old adage, or the old thing about some people, I've heard it many times, is why me? Why did this happen to me? Well, my attitude is, why not me? I'm not any better than anyone else. So therefore, I feel I can have a better discussion than if I was approaching it from a negative standpoint.
Yeah.
Good advice. How about you, Gloria?
I believe that people know. I believe everybody has a basic instinct about what is kind of a gut reaction. Call it instinct. Some people might think it's divine guidance or their connection spiritually to a higher being. Whether or not there's something else for you, whether you need to combine therapy or just investigate something else. And my advice is just don't give up. Don't give up, no matter how hard the road is, the more difficult it is. Don't give up, because once you give up, you can have losses that you don't gain. I do recommend, as Alice says, investigating alternative therapy like the ion foot bath. I've been doing that regularly. I get a weekly deep tissue massage. Also, I'm a standing appointment with a good therapist on that. I also visit a homeopathic doctor that's a PhD in homeopathy. See her about once a month to look at homeopathic remedies that I take specifically for kidney function, for my GI issues because of celiac disease. And then the latest was the functional medicine doctor, adding that in addition to the 6 or 7 doctors I see at the University of Michigan for all my other autoimmune diseases. So if you have other conditions, stay up to date on that too, as to what you should be doing and where you should be going on that.
Yeah, and collaborating, because, you know, with many autoimmune diseases, a movement in one direction on one of them can actually exacerbate other ones. So I think that's really wise advice to have those type of. You have something else, Alice?
Yeah, one of the biggest ways that I advocated for myself throughout this entire thing with myasthenia is that I do not hesitate to find a new neurologist. If your neurologist isn't listening to you, if they're not communicating with you, if they're not agreeing with you on the way you want to treat yourself, you need to look for a new doctor, because they are not the person for you. They are not helping you by making you sit still and not be able to function as a human. I had doctors like that. I had a doctor that was highly rated neurologist. And every time I went into his office, he would bring a student and talk about general myasthenia gravis. Now, I have MuSK. I am very rare. And I think that that would be a major teaching opportunity. He didn't think so. So he was fired. And so fired. That is very important to remember. You have that ability. You know,
Thanks, Alice. It's been great discussion, and I mean, that's why these types of meetings of patients talking about real stuff are so important, and it is inspiring to other people. There are several comments on that. Dave, somebody said that you're helping him. Somebody mentioned that they are on Rituxan and that it has worked for them, Alice. And that's the thing, is everybody is different. It's being a snowflake disease. Gloria, everyone loves your orchids, so I wanted you to mention that, because those are very well placed. There's a couple links to Ion Cleanse in a Facebook group where that therapy can actually be found.
I am an admin. In that group. It's specifically for myasthenia gravis.
Okay. And so somebody asks, Gloria, can you compare reactions to IVIG and sub-Q IG? Pre-meds and side effects, what were some of the things that you found with that?
Well, the IVIG went well. The home infusion was great. I know many people have to go to an outside clinic, and that was difficult for my husband, always working, providing transportation, being there, staying with you. So we didn't want to do an outdoor clinics or offsite clinic. It was wonderful that we had those years at home doing the infusion at home. And I really didn't have side effects. It's just the doctor I had always ordered blood work before the infusion. And what I noticed that my kidneys were dysfunctioning. Now, what I didn't put in my autobiography here is I happened to get a very bad lung infection in 2005 called Pseudomonas. To this day, no one's really sure how I got it. It was only in my lungs, but it was not survivable. And I was told this by multiple doctors that I could not survive. I was the walking dead. I persisted, and I stopped IVIG because I found a doctor who was willing to treat it with the infection with very strong IV antibiotics plus oral antibiotics. And I knew for sure, just common sense, combining that with IVIG would just be too strong on my kidneys. Now, what happened was the treatment did work, even though I was told by a lot of people that it wouldn't. There was nothing to save me, but we were going to try it anyway. But it damaged my kidneys permanently, but I'm still here. I only have mild damage to my lungs from the prolonged infection. I'm off of all medications for that particular condition. Going to the sub-Q, again, what I like about it is the freedom and flexibility that you pick the day, you pick the time. It's a shorter infusion. There's something empowering when you're putting the needles into yourself. Now, this goes not into the vein, but into the skin. So it's not as scary. I'm afraid of needles. I've hated needles since I was a child, and I still hate them, but I'm able to do this on myself. I never thought I would get to that point. But I am. It's not that big a deal. It's not that hard. And I've been continuing with the Ion Foot Cleanse. I've cleaned up my diet because I had to because of celiac disease, and I'm eating really healthy, got out the bad fats out of my diet, put in good fats. And so my kidney function now is higher than it's been in many, many years since I was diagnosed with the chronic kidney disease. My kidney function is almost normal. And I was told years ago that it would never be normal. There was nothing I could do. I just had to wait for dialysis. And this is from medical doctors, all gloom and doom. I saw everybody, the chief of every nephrology department, and I was told that. So when I say don't give up, don't give up. I really need it. It worked for me. And I'm still here. And I have to say, I'm older than Alice's mom. So I'm probably one of the oldest
You
people
look
with myasthenia gravis.
fantastic. I would have never guessed that. Oh my gosh, you look so good, Gloria.
Yeah, my journey started a long time ago. My symptoms started in the 90s. That's 30 years. And I'm only officially diagnosed 20 years, but that's because I didn't have the antibodies. They couldn't find the MuSK antibodies or the acetylcholine. They found everything else, but they couldn't find that. So doctors often have an attitude, you're not really sick if you don't have these antibodies. Or a lot of times neurologists, you say fire neurologists, but a lot of times the feeling is if you've never had a crisis, you really don't have myasthenia. In other words, your condition is considered mild, therefore doesn't need treatment. Well, from the patient point of view, what they call mild is at least moderately severe because it impacts your life and everything you care about, everything you want to do. So this is why I believe in what SubQ has helped me. I hope I answered that question. I'm sorry, did I digress?
Yes, no, you
Okay,
did
keep
answer
me
it.
on.
Somebody asked what MuSK is and what seronegative is, and there was a really good answer just immediately after that MuSK is a type of myasthenia gravis autoantibody, just like GMG and LPR4. Seronegative is a term applied to when an antibody has not been identified at that point, at the point of the test in your system. And it may be that the antibody is not one that we know about, or it may be that there is something that the antibodies don't build up and not testable. More and more is being discovered about seronegative. So come on Saturday to hear our seronegative talk, because he is a researcher in that area, and it's going to be really, really helpful for people in the community when other people talk about seronegative or not getting treatment. Elaine Schuster says her neurologist had a suggestion for a blood test in 2010 when she was first diagnosed, but never had it. She only had droopy eyelids. I think that more and more antibody testing is going to become important, and it helps somebody advocate for themselves, knowing as much as they can about their own version of myasthenia gravis. You're an expert in your own version. And I think that is the number one thing that when I talk to patients, and I've heard Esther do the same thing, of what you're experiencing, and figuring out how you need to convey that is the most important thing for you. And whether you need to bring somebody with you or you need to have a practice conversation. Certainly I've seen Esther do that. Rhonda has done it. So advocating for yourself is really important wherever you are, whatever antibody status you have. Thank you so much for this fantastic conversation. I can't wait to master this and put it on our website, because I think it's really good conversation. And thank you for joining us tonight. I appreciate it, and have a great evening.